Welcome to Breakfast with Spaniels with Dr. Judy Morgan. Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
No. Okay.
No.
We're good. We're live.
Puppy
I
on
got
the
the words.
puppy.
Hey, everybody. Mary Paul, I didn't remember to wish you a happy birthday yesterday, so happy birthday. Sorry, I was behind schedule on things. And yes, we are late today. It's lunch with spaniels. I don't know. Breakfast, lunch, something.
And this cute spaniel.
Oops. And there's I gotta get the sound off my phone. And we are at the office today with all of our dogs because at the house today we are having fencing put in. We have some drain work being done from our wash stall from the barn. So just lots of stuff going on. So we decided that everybody should come to work today. And then we were treated to a visit from the folks from Viva Raw, and I was remiss in not getting some photos with them. So we're gonna make them come back. They're local. And so I wanted to give a special shout out to Rachel Kathleen McReynolds, who made my George puppet. See a similarity there? George, can you look at the camera? He says this is as close as I get. So this is George in his little chef's outfit, which had I thought of this ahead of time, I would have put George in his chef's outfit, but it's at home, so I can't do it. So, but anyway, he's very cute and very adorable and pretty life size. It's actually a sad segue into what I want to talk about today, because George is an English toy spaniel and Gabby, our little Ruby, is an English toy spaniel. And Gabby's original owner reached out to me yesterday and said that a 2-year-old English toy had been given, she called it a flea injection. It's not exactly what it was, but an injection at the veterinarian, and the dog started having seizures and was really struggling. And what could she do for detox? So I said, well, I needed to know what the medication was. And she got back to me, and the injection was ProHeart, and it was the ProHeart 6. ProHeart 6 contains Moxidectin. That sounds a little bit similar to ivermectin because it's kind of in the same family. It's an ivermectin family. But Moxidectin is much more toxic than ivermectin has been over the years that it has been out. Moxidectin originally came out in the 1990s and was used for cattle and horse dewormers. We would see toxicity in dogs who would either, and I used to see this in the emergency clinic when I worked there, somebody would be deworming their horse and a blob of the deworming paste would hit the ground and the dog would swoop in and eat it. I had one dog that did that, came in shock and collapsed. It ended up, the dog actually, it was an ivermectin paste at the time. The dog was heartworm positive, unbeknownst to the owners. When it ate that glob of ivermectin, first of all, it was an overdose. Second of all, it it started a huge die-off of the microfilaria in the bloodstream from the heartworms, which put the dog into anaphylactic shock. So we used to see with these products that the toxicities in dogs would occur when they would either eat the paste that fell out of the horses or cattle mouths, or if they ate stool within 24 hours of the livestock being dewormed and the chemical product was high enough concentration in the stool that it would cause seizures and death in the dogs. Somewhere along the way, somebody said, hey, we can actually use this product in our companion animals. And so there are a few products that contain Moxidectin. One is Advantage Multi, which is a topical flea product. And then the other is ProHeart. ProHeart is an injectable, and I've talked about this before, and I have blogs about this. It's an injectable medication that lasts for 6 months. So, you know, we've all gotten so lazy that it's too hard. We used to have to give heartworm preventative every single day back in the 70s and 80s. Then they came out with the monthly HeartGuard Interceptor, and it was once a month. So, boy, our life was so much easier. We only had to give medication once a month. And then maybe 10 or so years ago, they came out with the ProHeart injection, and it's good for 6 months. Wow, isn't this simple? We take the dog to the vet every 6 months, get him jabbed with an injection, good to go. He's got heartworm preventative on board. Yeah, just one little problem with that. The injection killed so many dogs, put so many dogs into liver failure, caused seizures, muscle tremors, vomiting, diarrhea, drooling, just tons of side effects. Killed enough animals that they actually pulled it off the market. Now, we all know how well the FDA works at getting things off the market because we have had about this much luck getting the isoxazoline products off the market that have killed tens of thousands of dogs and cats. But this particular drug actually killed enough animals that it was removed from the market. The only problem is that it was brought back to market a couple of years later. Now, one would think that if you pull a drug from the market because it's so toxic, when you brought it back, it would have had changes made to it. Nope, not a change. What they did was they changed the packaging, and the packaging then came with some warnings, and that's kind of what they've done with the isoxazolines. Little warnings on there that say, might see some neurologic side effects. Probably shouldn't be used in animals that suffer with seizure disorders, except that I see it being dispensed to animals with seizure disorders all the time. So either nobody reads the packaging, or they just don't care, or they don't get the connection. So the problem with this drug is it came back on the market, and veterinarians are supposed to read that insert, understand which animals it can and cannot be used for, and things like animals with pre-existing liver conditions, animals with pre-existing kidney problems, senior pets who may be suffering with chronic inflammatory problems. Oh, by the way, probably shouldn't give it at the same time that we give 10 vaccinations. Should not be given to sick animals. Well, unfortunately, it gets given in all of those situations. And also, unfortunately, even in some healthy dogs, we will end up with seizures and death. This little 2-year-old English toy spaniel died. It had neurologic side effects, seizures. It died. 2-year-old healthy dog from a 6-month heartworm injection. But wait, there's more. It gets better. Now they've come out with the 12-month injection. So we're giving an even higher concentration so that it lasts longer. And guess what, folks? This is kind of like those oral flea and tick meds that we are so against. You put it in, you cannot get it out. You just put something in your pet's body that is going to last 1, 3, 6, 12 months. You can't get it out, and there is no antidote. So if your pet suffers with side effects, seizures, now your pet is sentenced to having to be on anti-seizure medication. Could be for 6 months, 12 months, till the medication is out of their system. Could be that that's a lifelong change. The circuitry is screwed up in the brain, and it could be lifelong medication. So my question to you, is it worth it to give something by injection that is going to last 6 to 12 months, that you cannot get back out, and that you have no antidote if the pet has a problem. So I am very, very, very much against this injection, and I am very much against veterinarians presenting this to pet owners as, look, this is so simple. No, we haven't seen side effects, no problems. I beg of you, when your veterinarian wants to prescribe, and this goes for you with your own doctors as well, when someone wants to give you a prescription for any drug or chemical, when you go to the pharmacy to pick up something, you get that insert and you get all the warnings, and you can actually be counseled by the pharmacist on the potential side effects of the medication that you're being given. And it'll usually tell you how that medication might interact with other medications that you might be taking. And it's all in a computer database so that generally they know all the things that you're on. But when you go to your veterinarian, it is very rare for them to say, here's the package insert, here's the potential side effects, here's what you should watch for. Oh, by the way, before I give you this injection, let me just tell you what the potential side effects might be. Do you still want me to give it? So what I would implore of all of you, before you allow anything to be put on or into your pet's body, ask. Ask, what are the side effects? What potential problems could I see from this? What should I watch for? And that includes vaccines. Something as simple as a vaccination. Anything injected into your pet or applied topically to your pet or given orally to your pet can have a side effect. And you need to be aware of what those are. And maybe they would say, oh, well, you know, once in a while we see vomiting, or once in a while we see diarrhea, or once in a while we'll have animals that have seizures. Well, that might raise a red flag for you where you say, ooh, my dog has a really sensitive stomach and he tends to vomit if I just, change his meal by one little thing. That might be a problem. Maybe I don't want that. Or, oh, my dog has had a history of seizures. He had a few in the past. Maybe I don't want to use this medication that affects the neurologic system and could send my dog into a seizure problem. So you need to be aware. You need to ask questions. This is all about being educated and being an advocate for your pet. And the best way to be an advocate is to be educated about the potential side effects and what you should be, sorry, you're falling asleep there, buddy. What you should be watching for. He's a little heavy. Right, George?
Someone was asking about how you feel about chewable flea and tick prevention.
Well, chewables are probably going to be isoxazolines. Not a fan. Not a fan at all. So I do not recommend it. Yeah, this is Nanny, for those of you who don't know Nanny. George is my dog, but since, actually for a long time, George has adopted Nanny. Since Shotzi passed, definitely he's adopted Nanny. He sleeps with Nanny, he does everything with Nanny, but even before that, he kind of glommed onto you. I had to give up my dog.
Hold on, I'm gonna copy and paste your flea and tick blog.
Oh yeah, so Gwen has she's gonna try to paste copy and paste in our flea and tick blog, and also how to detox your animals if they are having a reaction to some of these chemicals. It's not exactly a one size fits all, but it's pretty close. There are no antidotes to these things, so the best you can do is try to detox their system. It's going to include a clean diet. It's going to include a lot of antioxidants, things to drain the liver, drain the kidneys, really support the body. So this is a huge problem. I would strongly, strongly recommend that you do not opt for injectable heartworm prevention, particularly if you have a dog breed that is one of the MDR1 mutation. They may have renamed that now, but if you have a dog who has that sensitivity, definitely more susceptible. But these are drugs that are not supposed to cross the blood-brain barrier, which is the barrier that keeps things that are in the bloodstream from getting to your brain and causing toxic problems and seizures and neurologic symptoms. But for a lot of animals, it gets there anyway and causes problems. Okay. All right, we got protectthepets.com for titers. Just turned down to adopt a senior from a local shelter because I don't use oral flea and tick meds along with not vaccinating yearly. Yeah, we need to be educating these places. It's very sad, very, very sad. Yeah, they do pick their people, little stinkers.
George picked
vaccines
Danny.
for some things are necessary, but not at the recommended doses. Do titers only get vaccines when titers show they're at risk if they are at risk for contracting disease? Yeah, I mean, there's no one size fits all. You have to talk to your veterinarian about the risk that your particular pet has. A dog living in a high rise in New York City has a much different exposure level than a hunting dog in New Orleans or Louisiana. I mean, it's just totally different lifestyles. So, okay. Your dog started having seizures after using a Seresto collar and died 6 months later. Chemicals, folks, chemicals. We're causing problems. So
Yeah, someone on Instagram said that they were a vet tech until their own dog died of Bravecto, and they left the field.
Yeah.
Sad, super sad.
it is super sad because as a veterinarian or as a technician working in a practice, you think you're doing what's best because the drug companies tell you this is the best thing since sliced bread, and then you accidentally kill somebody's pet or your own, and it is very hard to get over that. I would strongly recommend that you don't beat yourself up over that because you don't know what you don't know. But once you do know better, then you are the perfect person to be an advocate for treating our pets naturally, and tell your friends. Okay. Alrighty. Could these meds have caused your dog's pancreatitis? You don't see it as a side effect. Well, here's the thing. Pancreatitis is an inflammatory disease. So when we give any kind of chemical that sets up an inflammatory reaction in the body, it can show up anywhere. Most of it tends to be neurologic, but we do see a ton of GI side effects with these: vomiting, drooling, nausea, anorexia. So it's definitely affecting the liver, can be affecting the pancreas. I mean, it all kind of works together there. So, okay, Gwen, are you giving us music?
I don't know how to do outro music.
Okay, that's fine. Using Frontline still has fleas 2 days later. Yeah, it's going to be a while. It's not with any of these things. You don't give them one treatment and poof, fleas are gone. You have got to treat the environment. You've got to treat the house. You've got to treat the yard. It's not a quick fix when you have a flea infestation. The puppy is now rearranging the carpet. Okay, we're gonna get going. I will most likely be on tomorrow. Right, George? Georgie?
All right. I'm just gonna end Facebook, but I'll grab.
Welcome to Breakfast with Spaniels with Dr. Judy Morgan.